Continue the mental health conversation. With us now is Dr. Todd Ellerin. Thank you for being with us.
Great to be with you.
You know, Dr. T, let's start with something that we don't start with enough. How are you? How are you?
Oh, can I take a deep breath?
Take a deep breath.
Please.
All right.
How are you?
So listen, we just have to have witnessed the past few days to know that the world is fractured. So for today being Global Mental Health Day, I think it's so important. I'm so happy that we're talking about this and raising awareness, because we cannot suffer in silence. We have to know that resources are out there to help us, and I think some of this, as we get help, will help repair the world.
Yeah, interesting. Very good.
We know the COVID-19 pandemic took a toll on everyone's mental health, but you guys, especially on the front lines there, you witness people every day becoming sick, some people even passing away, and all the while worrying about your own safety through that process. The stress of all of that, even now, how are you seeing that having effects on you all working at South Shore?
Right. There's no question that the pandemic has really, been a source of immense stress. We're obviously in a better place from that, but there's still kind of that post-traumatic stress, that we're all feeling, and we're seeing it as healthcare providers. I think one of the things I'd call attention to is really burnout. And I think because we're working so hard and have seen such life and death situations, that it has really had a toll on us. With that said, there are resources out there, and South Shore Health has brought peer support groups. They have hired a person, Michael Navarez. He's the director of our colleague support and well-being. That hire was so important. He is helping us in so many different ways to know that there are people we can talk to.
At what point do you recognize it's smart to bring in someone who can help you?
Man, it was the pandemic that helped bring him in. Our head of OB/GYN, our chief medical officer, and our chief of surgery brought him in. He was from MGH, is at MGH, and I think it's just, you see so many people stressed out. People are dealing with critical illness 12 hours a day. Nurses that are in rooms.
But they were doing that before the pandemic, no?
They were, but I think the pandemic and everything that it brought with it, isolation, social isolation, things like that, dealing with substance and addiction and time away from home and concerns about coming back home, I think has led us to realize, put this front and center. And one thing we have to talk about is destigmatizing mental health.
Yes.
That is critical, because if you feel like it's a stigma, if you feel like it's something you can't talk about, then you're sort of dealing with it with isolation. It's hitting you. It's sort of like a slow, silent killer. If you feel shame, it deals with anxiety, and so you have to realize that there are resources out there that you want to try to address and get help.
Good point.
Yeah, you cannot stress that enough. Dr. Ellerin, we always appreciate when you're here, because those symptoms show up differently in each person and how they're dealing with it, and it can really be detrimental if not taken care of.
I want to say just one more thing. A key resource called NAMI. National Alliance for Mental Health.
National Alliance for Mental Health.
NAMIMass.org is an excellent, concise, simple, user-friendly website for people that are feeling like they're maybe alone. And even if you're just curious about, you have a problem, it doesn't have to reach an extreme place. There are places. Go to your PCP. Go to the web and places like NAMI and others. Help is there.
Good to see you.
Absolutely. Thank you so
Be
much,
well.
Dr. Ellerin.
Take care.